So now we're going to show you how to foam roll the glutes on the side of the hip to help with sciatica. So Kate, what you're going to do with the foam roller is you're going to have the foam roller sitting here on the ground, and you're going to find the spot between that greater trochanter there, or that part of the bone that sticks out into the leg, and the other part of the hip. You can feel the other part of the bone there, and you're going to roll this area right in there, just like we showed you before. Kate's going to get on top of the foam roller there. You can see that she's got most of her body weight on it, except for some weight on the ankle and on the foot, and she's rolling nicely over there. This other leg right here that's providing some support is going to help take some weight off of the foam roller so it's not too intense. And you can see she's just rolling very nice and gently between the hip bone and between that greater trochanter. And if she finds a really stiff point, she could just simply let all of her body weight sit on it. So Kate, show everyone what that looks like. Yep, perfect. So she's going to have more body weight on there. She can work through a tight point or a tight trigger point, and that will help that to release and help with some of that sciatic pain. Now, well, one thing that Kate does not want to do, she does not want to roll. So Kate, if you roll a little bit farther down, perfect. How does that feel?
It hurts.
Yeah, so you don't want to roll onto that greater trochanter, and then if you roll too far up onto the abdomen or onto the hip, you're really going to notice it because it's going to be quite sore. Next, we're going to show you some of the strengthening exercises that you should do to help with that sciatica. So the last part of managing our sciatica complaint is making sure that we add some strengthening exercises through the hip to help prevent it from coming back into the future. So Kate, we're going to be targeting the gluteus medius and minimus and the oblique muscles on the side of the hip. They're going to help prevent that sciatica in the future. So we're going to do 3 drills here. And Kate, I'm going to get you to lie down on your side on the table. And so the first drill that we're going to be doing is the side bridge. You know how to do the side bridge?
Nope.
So we're going to go over that. So Kate, what I want you to do is bring your knees back so they're lined up with your body. Perfect. And then you're going to put your right hand down onto the table with the right elbow. Yep, bring it back a little bit farther. Perfect. And then you're going to prop yourself up just onto the elbow, lifting your bottom off the table. Good. And now I'm just going to provide a little direction. You're going to clench your glutes. Good. Tighten the core. Good. And if you could see from this angle, Kate's lined up ear, shoulder, hip, knee, perfectly stacked up there. Really good activation through the glutes and the obliques. Nice and tight here, nice and tight there. And Kate, how's that?
Good.
Is it hard?
No.
Okay. So once you've mastered that, what we can go on to next is add a couple of more challenging components to the drill. I'm going to get you to come back up, Kate. Remember, tighten the glutes, ear, shoulder, hip all stacked up. And the next thing that we're going to do to make it more difficult, you're going to separate the knees in a clamshell. Perfect. And Kate's going to work on holding this on both sides for up to a minute. So Kate's been there for a minute now. That's great. You can relax. And then the last drill that we're going to show is we're going to show a side bridge with lifting the leg up to the side, or into late abduction. So Kate, you're going to go back into that position and clench the glutes, get properly stacked up in the right spot. And on this one, Kate, you're going to bring the leg up straight. You're going to bring it back just a little bit, making sure that it's extended backwards, not using the hip flexor. And you're going to use the glute back there to hold it up for upwards of a minute, working your way slowly up there. And if you don't like holding it for a minute, you can do 3 sets of 10, lifting it up and down. And Kate, can you show what that would look like? So a little bit slower. So down all the way, and then lift it back up. Nice and slow. And you could do 3 sets of 10 of those. So Kate, you can relax. So these sideways exercises, strengthening the obliques and the glutes on the side of the hip, they are great for strengthening those muscles that are often responsible for sciatica, and are really, really good core strengthening exercises in general. So if you're struggling with sciatica or pain down the side of the leg, especially if you sit too much, try some of these drills, and I can almost guarantee it'll make a tremendous difference.